In our last lecture, we have discussed about the clinical findings of herpes simplex virus 1. Today, I'm going to discuss about the clinical findings of HSV2. So, HSV1 is a above-waist disease, and because of the infection of HSV2, this is below-waist disease, mostly genital herpes. So genital herpes, it is a painful vesicular lesions of both the males and females genital and anal area. The picture shows you about the painful lesions of both the genital and the anal area, the pineal area. The lesions are more severe and extended in primary disease than in recurrences. Primary infections are associated with fever mostly. In case of asymptomatic infections, so source of infection is definitely the other individual. And in case of men, the area is prostate or urethra, and in case of women, area is cervix. Then comes neonatal herpes. So again, the clinical findings for HSV2 mostly originates chiefly from contact with the vesicular lesion within the birth canal, varies from severe disease, as for example, disseminated lesion or encephalitis, to milder local lesions in skin, eye, and mouth, to asymptomatic infections. It can be prevented. This particular type of neonatal herpes can be prevented by performing cesarean section on women with either active lesion or positive viral cultures. Next type is erythema multiforme, can be termed as EM. Both HSV1 and HSV2 is responsible for this particular type of infection. So what type of symptoms is like the central red area surrounded by a ring of here you can see here you can see this central red area surrounded by a ring. Here you can see the ring surrounded by a ring of normal skin, outside of which is a red ring. You can see here outside is a red ring. It's just like a bull's eye. The lesion looks like a bull's eye. Lesions are typically macular or papular type, and occurs symmetrically on the trunk, hands, and feet. Many drugs, especially the antimicrobial drugs like sulfonamides, they are commonly the causative agent of EM. This particular disease is also known as Stevens-Johnson syndrome, associated with fever, destructive oral lesions, extensive desquamating skin lesions. So skin lesions just means that skins are coming off in scales or flecks, just like the scales or flecks. Skins are coming off. Now we are going to discuss about the spreading of both the type of herpes simplex virus 1 and 2. HSV1 can be contracted from general interactions such as eating from the same utensils, sharing lip balm, kissing. These are the common modes of spreading of HSV1 type of virus. And HSV2 type of virus is definitely by sexual contact with the person who has the HSV2 infection. Now, what are the signs? The symptoms are associated with this particular viral infection. So, blistering sores, that is in the either in the mouth, the lips, or on the genitals. Pain during urination signifies genital herpes. Itching surrounding the area or the lesion area. or the person may experience symptoms that are similar, like flu, just like fever, swollen lymph nodes, headache, tiredness, lack of appetite, like that. So these are common symptoms for flu. Next type of clinical finding is herpes keratitis. So HSB can also spread to the eyes, causing a condition called herpes keratitis. Here the symptoms are like that is eye pain, discharge from eye, and a gritty feeling on the eye. This is a common symptoms of herpes keratitis. Now, how to cultivate this particular type of virus in laboratory? So, continuous cell line culture to be done, and here monkey or rabbit kidney cell lines you can use for cell culture, or else you can use HeLa cell, or and human amnion cell line you can use for in vitro culture of this particular type of virus. So if you have this particular type of looks of the cell after infection of this HSV 1 or 2, then well-defined foci with the heaped of cells and syncytial formation as seen in this picture, if observed, then clearly we can say that here is the infection caused by HSV. You can also grow the cell or cultivate the cell in chick embryo. CAM assay you can do that, and tiny non-necrotic pox are seen here in this picture. You can see, so signifies infection of HSV. Now I'm coming to the pathogenesis part. So this particular type of virus enter through the skin or mucous membrane and then start multiplication. So replication start at the enterocyte. So they will not wait for anything. They will immediately start replication at the enterocyte. The virus enters the neuron or the sensory nerve, the root ganglia, and then will go for latent infection or latency. So here you can see, you can feel a cold fever, means surgery as an unknown thing. So the latent infection you can observe here, and they can reactivate and return to the site of initial infection. So this may happen. So infection may produce vesicular lesion. They will come out from the latent phase, then the go means by lysing the cells, and then infection may produce vesicular lesions, which contains fluid and infectious variants. Actually this lesions actually the responsible for creating this ulcer. So this is all about the pathogenesis of this particular type of virus. Now, diagnosis of this particular type of virus. So the first step is the smear. So you have to take either the serum, or else the spinal fluid. So isolation of the virus from the lesion by growth in culture, and then look for the typical cytopathic effect that may occur within 1 to 3 days. I have already shown you the picture how after means how the cytopathic effect will look into the different cell lines. It may be monkey kidney cell lines. It may be HeLa cell lines. It may be human amnion cell lines. So after typical cytopathic effect occurs within 1 to 3 days of infection or inoculation, then you have to go for identification using specific antibodies tagged with fluorescent probe. So identification by fluorescent antibody staining of the infected cells directly by immunofluorescence technique, or else you can go for ELISA technique, enzyme linked immunosorbent assay. So first, the analysis can be done by smear analysis. It is a particular method is known as Zank smear. This is a very rapid diagnosis of HSV. So here the solution is a 1% aqueous solution of toluidine blue. So if multinucleated giant cells with fested nuclei and noticed, then we can say that these cells are Jank cells. And here the best stain is either GMSA or else Papanicolu stain. Next is serum isolation. So isolating serum, then you can check for smear for primary infection from the primary lesions, or you can go for ELISA test or complement fixation test. And you can also go for antigen detection using fluorescent antibody or ELISA. Here a picture, in this picture you can show that this HSV infected epithelial cells, they are actually expressing some, these antigens are present and a specific antibody tagged with the antigen and fluorescing. So virus isolation, you can go for cell culture, and within 1 to 3 days you can get the get the data, get the intimation for primary infection. Or else if you go for a rigorous study, you can go for molecular technique. You have to go for molecular technique, and there you have to use PCR. So preferred is it is indeed a preferred test for detecting HSV in spinal fluid. PCR should be done. Next is a type-specific serological test. So to confirm whether it's HSV1 or HSV2, you have to you cannot go for a non-specific antibody test. You should go for type-specific antibody test, and this type-specific antibody should be tagged with a fluorescent probe, and that fluorescent probe will tells you whether it is HSV1 or HSV2 infection within the first few weeks to few months following infection, and persistent infection is there because they maintain the latency. So presence of HSV2 specific antibody indicates anogenital infection, and presence of HSV1 does not distinguish anogenital from the oral infection. Next is the treatment. So there are so many drugs that are now being used for the treatment of HSV, both 1 and 2. So idoxuridine and trifluorothymidine, these are two nucleoside analog, modified form of deoxyuridine. They are actually used. So in this picture, the top you can see the modification or substitution of iodine, and the bottom you can see substitution of 3-fluorine. So incorporation of this particular nucleoside 5' triphosphate into the nascent nucleotide actually prevent further growth of the viral DNA or viral RNA. Means they are actually responsible for chain termination. So they inhibit multiplication of the herpes virus. This particular type of drugs, they can be mostly used for topical treatment because they are toxic. We cannot recommend for systemic use. They can be recommended for topical use for herpes simplex keratitis. So here, how the drug enter into the cell, and then they convert into the bioactive molecule. So in our cell membrane, we have nucleoside transporters. So the nucleotides of the bases will either actively transported or passively transported by diffusion process. And then if they enter within the cell environment, means within the cytoplasm, and if that cell is infected by HSV, so they will utilize the thymidine kinase of HSV, or register virus thymidine kinase. So using this kinase, actually they use 1 mole of ATP and they will convert into their respective monophosphate. And then the monophosphate will then convert to diphosphate and triphosphate by using host cell kinase. And these nucleoside triphosphate actually function as a bioactive molecule. These are nothing but the nucleotide. So there is a competitive inhibition between these synthesized nucleotide or the bioactive molecule and the native nucleotide. So this particular nucleotide will bind with either the polymerase, RNA polymerase, DNA polymerase, or else with reverse transcriptase, and then they will stop the elongation of the DNA or RNA. So as because they inhibit this elongation process of DNA, so nascent DNA will not mature and hence the virus will not complete its replication process. So through this we can we can restrict the growth of the virus into the animal cell. Next one is vidarabine. It's another synthetic purine nucleoside analog and also inhibits HSV and VZV multiplication, and it is also acting the similar fashion. Chain terminator acts as chain terminator, specifically inhibits the viral DNA polymerase more than the host DNA polymerase. So not affecting more the host DNA polymerase, but affecting more the viral DNA polymerase, and then inhibiting the replication process of the virus. So this particular drug can be used for herpes simplex keratitis and herpes simplex encephalitis, and as because of low toxicity of the drug, intravenous use can be recommended. Now the third one is acyclovir or famciclovir. It's again a synthetic nucleoside analog. It's a guanine linked to an open ring analog of ribose and deoxyribose. So thymine and cytosine derivative it's there. So phosphorylated forms of this nucleoside analog again utilize the thymidine kinase of HSV. Here through this picture, you can schematic picture, you can get the idea that after the entry of the compound acyclovir, so they utilize 1 mole of ATP, and then with the association of HSV thymidine kinase or VZV thymidine kinase, they will convert into their respective monophosphate. Then utilizing human enzyme, they will convert into the respective triphosphate, and then now the triphosphate will interact with HSV DNA polymerase and inhibit herpes virus DNA polymerase competitively. So penciclovir, genciclovir are a similar type of drug. They are also active by the same mechanism, and they can also be used for the treatment of HSV. So due to the prolonged use of this particular type of drugs for the decades, herpes simplex virus has developed resistance to acyclovir and penciclovir. This is indeed a dreadful situation for us. We have to think for the alternative. Actually, they are resistant. So this herpes simplex virus thymidine kinase that the acyclovir or penciclovir is utilizing to prepare their monophosphate, but they have changed this enzyme, thymidine kinase. So they are resistant to that, and again they develop resistance to HSV DNA polymerase. So after administration of acyclovir or penciclovir, due to having resistance, in these two sites or in these two locations. So these two drugs are not acting finally. So we have to look for new alternative of to inhibit the growth of HSV in human system.